Hey, I'm Dr. John Martin from Miami, Florida, and today we're going to be doing some tear trough filler. Now, one of the things I like to do in the tear trough is take 1 cc of a filler that I like to use, and I'll dilute it down with a little bit of normal saline. And what that does, it just makes it a little bit thinner, and I think it goes in more easily. It allows me also to go a little bit more superficially, and I think it also decreases the incidence of having any nodules. So just go back and forth a few times, and then you'll be ready to go. So I'm going to use a cannula. You can certainly use a cannula or a needle. I like to use a cannula because it's just one entry point, and then it can kind of come both medially and laterally. And it just has a little bit of a tear trough depression here that looks dark, and we've done this before, and when we fill it up, it definitely helps. And a little bit here laterally as well. And I gave her a drop of lidocaine here already. Then what we'll do, my loops, is you're going to do a little poke in the skin. So you just come in here. Now, Dr. Kate Goldie told me when you come back out, if you flick it like that, it makes the hole a little bigger so you don't get caught trying to find your hole all the time. And you'll come into your hole. And then I'll start. So initially I'll go deeply, so you can see I'm pretty deep here at first. And I'll come in, and I'll come a little bit more superficially. And you can almost see the cannula there. And by diluting my filler, or using one of the thinner fillers, I think you can safely do this, and you won't see the, and you can see you have a nice fill there. And if you compare it to the other side, then you can take this, and if you think you're not totally smooth, you can just sort of smooth it out. Then what we're going to do, now your orbicularis retaining ligament is here, and it's kind of tough sometimes, and as you poke through, sometimes it's not easy to get through it, and they'll feel it a little bit, and they'll hear it a little bit, but this is how you can fill over here in the lateral corner. And I like to use my finger as a guide. You can feel it under the deep tissue there. There we go. Okay. Now I'll take a Q-tip and just sort of spread that out a little bit, so you get a nice fill of the lateral portion of the tear trough. Looks like we have one little lump there, so look up for a second. That's better. Okay. Now the other thing we'll do frequently, we hardly ever use topical. What we'll usually do is ice people beforehand, but we use a vibrator a lot, and that really decreases any pain that people have on injection. So they feel almost nothing. Even if you're doing lip filler, if you use a vibrator, it makes a huge difference. And you can get any type of vibrator you want. We get these little ones, and we'll just put it right here. I should come down just a little bit. What I'm going to do is go in here. So just make a little poke, do my Katie Goldie flick as I come out. And I do that because at one meeting I was doing a live demo and I couldn't find the hole. And with this you'll get a teeny bit of blood usually, and then you can just scoot in. So I start deeply, running up where she has the hollow. I'll kind of come back and forth as though sort of a technique we do with fat too, with fanning, and it'll come up more superficially. We'll fill in this whole area. The other thing it's doing, it should be releasing the tear trough ligament with the cannula, so you can probably kind of feel that. It'll kind of go make a noise. Okay. And then what I'll do is I'll redirect to be able to come up here more laterally. Just fill in this area here. Come up a little bit higher there. And a lot of people lose volume right in this area. And especially if you've had any sort of a surgery like a blepharoplasty. If you can. Okay. What you do is you can just smooth everything out with a Q-tip.